Opioids. Opioids are commonly used as a painkiller and they are very widely used in the medical practice. Like if someone has a heart attack or a operation, he has to be given the opioids injections. But it's been abused by many of us. Start as maybe the habit forming drugs and for enjoyment, but ultimately get dependent on them. In body, opioid has receptors and also in the brain, and that gives a feeling of high. So you try to take them again and again and in large quantities. The opioids are taken either by smoking, chasing, or sometimes snorting or IV injections. The HIV, which is transmitted diseases, is very commonly seen in the IV abusers, and IV abusers lead to lot of harm to themselves by consuming in a wrong way. This kind of a dependence lead to lot of antisocial behaviors where they become socially isolated, agitated, and does not cooperate with the society. They start living in their own world and they feel that nobody understands them and they don't want to follow any of the social norms. These kind of a behavior lead to lot of social disharmony, and when they are not able to get the money for this habit, they lead to petty crimes or serious crimes. Their family are badly affected because they don't recognize the social boundaries and social systems, and opioids are not accepted in society, so they are being illegally used and abused. They need a proper detox with the help of a proper medical setup where they are being given the opioids and they are gradually withdrawn and stopped. They take long time to detox, up to 3 weeks time, where their body start getting better. For long term staying clean, they need a long term approach which can be an outdoor approach or an inpatient approach. There are medical help is also available with the name of naltrexone, a medicine which can be used for the treatment where if they try to abuse they don't get high and ultimately they get clean and better. The naltrexone is available in different form like oral tablets, injections and implants. They have the different compliance issues and these kind of a different method help them to have the compliance. They are very effective and opioid treatment works very well if the client is motivated to take help. The marijuana is part of a plant of cannabis. It's been used in the form of smoking with the tobacco and it has different form. Either it's grass or hashish or marijuana. This all have a active component tetrahydrocannabinoid. The tetrahydrocannabinoid releases dopamine in the brain and give them a feeling of high or unrealistic world. They start hallucinating and they start feeling nice. When their use is becoming regular, they start separating from the society and gradually start living in their own world. They start liking music, they start liking the imaginary things and not lose they start losing the touch with the reality. They don't work, they don't want to study, and these days the younger crowd is becoming very commonly abusing marijuana. The brain chemistry is very badly affected because of the marijuana use, and marijuana affect their behavior. They develop different kind of a psychosis, and because of psychosis and agitation they don't cooperate. In last few months I have seen a tremendous increase in the need and abuse of marijuana, and they need a long term treatment. Their brain chemistry get affected and there is a dopamine disturbance. This lead to a psychosis kind of a behavior where they need a medical approach for their treatment. They need a proper detox, help and a proper medical approach. In our society, the use of marijuana is an ongoing long term problem which is gradually becoming more and more complex, and they feel they are doing only organic thing, a plant, so it's very well acceptable. Gradually, the prevalence and the life of the marijuana addicts is becoming difficult, and they are affected badly. They need a proper help and guidance. Please stop the young adults to take marijuana, because ultimately that's what creates problem in their life in long term.
Yeah, start.
These days, the use of marijuana is becoming more and more common among the students. They start at the age of 15, 16, 17 in class 10th, class 11th, or 12th, or first year of college. Their brain is very sensitive and they feel very high and elated after use of marijuana. Marijuana comes from the plant called cannabis. It's commonly grown in India and it's known as Indian herb. It's been there in India for many, many hundreds years, and there is an active ingredient known as tetrahydrocannabinol which is being abused and affect the brain. It causes release of dopamine and give them a feeling of high. So they start hallucinating or live in an imaginary world. Initially, when they use it once in a while, it does not affect the internal brain chemistry, but when they start abusing it on regular basis, they start developing a psychosis. They loses touch with the reality, they start living in their own world, they become aggressive, and they don't do the normal activities which normal kids do. They become alienated, and gradually when they come to the doctor try to give them this idea that please work on self and try to change. But it does not work. When the psychosis become too much and their life become completely unmanageable, they needed to be hospitalized and given some medication. They are very reluctant to take medicines and they feel medicines are chemicals while they believe only in organic or natural stuff. Their resistance for the treatment is high, which lead to multiple relapses and developing psychosis again and again. The psychosis loses the brain reality and a complex harmony of the brain chemistry, which ultimately lead to lot of behavior disorders and relationship problems. They need proper guidance, they need proper medical attention and long-term help to overcome the psychosis and marijuana abuse. Please motivate young kids and not to do the marijuana and get motivated to take help in a right way. We are not their enemy. They should trust the doctors and mental health professionals and believe in the medical science.